All right, today we're going to go ahead and talk about how to properly place our patient in our panorex machine. Our panorex machine is a far away image of our maxillary and our mandible, and it's important to capture a panorex on your patient about every 5 years. We want to capture that panorex x-ray on our patient even if they have teeth or if they are edentulous with no teeth, because we want to make sure that we would be treatment planning or capturing and treatment any abnormalities that would come that we would be able to visually see on an x-ray that we would not be able to visually see naturally with just looking in the patient's mouth. So I have Hannah here today. A couple of things we want to make sure that we're verifying that we have the correct patient with maybe a date of birth. Hannah being a female, I also want to ask, of course, if there's any chance of pregnancy, so we're aware if we're able to go ahead and take the x-ray or to get the maybe x-ray at a future appointment. A few other questions that I want to ask. Does the patient have anything removable in their mouth? Do they have any earrings in? Any piercings? Hearing aids? If they wear a denture or partial? These are all items that when it comes to our book are called ghost images. So we do not want something that is going to show up on the x-ray and also going to show up multiple times in our x-ray because it's going to do a double image. So I'm going to go ahead and place Hannah correctly in our panorex machine. So Hannah, I'm going to make sure I'm going to go ahead and position her. Do we want the plane of the teeth when she's biting together in occlusion correctly parallel with the floor? Of course, you want your machine at the height adjustment. And of course, we have the bite block that is already placed in our machine on to where the incisal edge of 8 and 9 is going to bite onto that bite block when she is positionally placed correctly. So I'm going to go ahead and lower this slightly. Hannah is going to step forward. And as we can see, Hannah's chin is not touching that block. So I'm going to go ahead and raise this up. A lot of our machines also have a handlebar here or somewhere in this vicinity. So it's great for your patient to go ahead and hold on to that so they feel secure. Of course, we have our laser lines, we have our mid-sagittal line, and we have our Frankfurt line. So those are the laser lines that we're able to see on Hannah's face, and I'll bring it closer so we can see when she gets into place. And we're going to take our x-ray. On our x-ray machine here, our panel, we can go ahead and see that this is a little helper that's going to help you show where those laser lines should be. We want our patients standing up straight. We don't want them hunched back. And we also want to make sure that their chin is not up too high, but it's also not down too low. So we're going to go ahead, lower Hannah a little bit more. We're going to have Hannah pull forward it and bite with 8 and 9 on those anterior teeth. I'm always going to have my patients smile real big so I can see their teeth. And this is where we have our temple holders as well. When I go ahead and push my play button, that temple is going to make sure that her head does not get turned side to side, and it keeps our patient in the position that we need them for when we go ahead and take that x-ray. For error-wise, I'm going to go ahead and lower Hannah. If I had Hannah's chin down too low, then I'm going to get a very big exaggerated smile. So you're going to see that after you take your x-ray, or if I have my patient up too high, as such, we're stretching Hannah out, but then it's going to show a really, really exaggerated sad face. So we do not want that either. All right. So we're going to go ahead and push my play button on my panel here. Of course, this is my control panel that's going to show me my KV, and it's going to show me my MA. Right now, my tube head and my x-ray is getting positioned correctly in order to step at the computer for exposure. I'm going to go ahead and push my green button and tell my patient to hold still. It's going to take anywhere from 10 to 30 seconds in order to capture that x-ray as it goes around, to capture then the panorex that we're going to see on the computer screen here shortly. So at this point, the x-ray is done being taken. The machine is resetting. The temples will go ahead and release. As soon as my patient is finished, they'll be able to step out of the machine. Also, what you want to have your patient do is close their lips and rest their tongue on the roof of their mouth. That will help eliminate some dark exposure with those anterior teeth as well. So I hope this will help you guys understand how to place that patient in that panorex. And we're going to go ahead and have the doctor go ahead and look at Hannah's panorex and discuss any treatment plan with her.